Hi, everybody. Welcome back to Pelvis Party. My name is Becky Montpetit. I am the owner of Rochester Local, and I've got two guests with me today. One you recognize, Dr. Melissa Richards, Division Chair of Hospital and Surgical Services. And our special guest today is Lisanne Shumway, and I'm going to have you tell us your title.
My title at Olmsted Medical Center is the nurse manager of the birth center, lactation services, and perinatal education.
Excellent. We're happy to have you here.
Thank you for having me.
And you're relatively newer in that position, is that right?
Yes. As of July of this year, I officially became the nurse manager.
Wonderful. Yeah. Congratulations. We're happy for you to be in that role.
We have to honor your previous manager.
Exactly. Yes, I was just going to say.
I took over for a legacy member of Olmsted Medical Center who grew the birth center, gave it a culture and a vision that I bought into it, which is why I relocated from out of state actually to become part of this group. And I stayed and just wanted to be immersed in it even more of the culture that they've created for our nursing staff, but especially for our patients. So Brenda did a beautiful job, and it's a big job to carry it on. But I think we all have that philosophy in our heart. So we're kind of ready to keep going.
Brenda, we just love Brenda. Brenda, if you're watching, I know that you watch these. Big love to Brenda. Thank you for all that you've done. So it truly is an extraordinary space.
Yeah.
So
I think we really want to honor the fact of all the effort that went into that and the intention behind the color of the walls, the layout,
the curve of the walls,
the layout of the room. Every little detail was researched and implemented with that genuine culture and heart. And I think that totally translates to a great place to work and a great place to grow your family.
No, grow your family. I mean, we had our first baby was born right before the birth center opened up, and I had phenomenal care there. And then for the birth center open up, then for my second, which was born 18 and a half months later, to have the new kind of experience. So it's the same level of care in a new facility. It was just really neat to see that transition, and really just how proud everyone was.
Yes.
To be in that space, and it just translates, right? It's just it was just made everything more just celebratory and exciting, and I just love the birth center. I walk up and get instant tears.
Yes.
It's so special.
It's something to celebrate. So
absolutely.
So tell us what your position, what does that look like, and how do you work closely with Dr. Richards and her team?
So my position is overseeing almost all aspects of the birth center and a lot of the departments that we work really closely with. So staffing, education, patient experience, how well are we doing with bringing education into our patients from the clinic level through our perinatal education programs, through the education they're going to get up on the birth center during their stay, and feel really ready to go home, prepared for this next step in their family journey, whatever that may be, because there's a whole variety to that. So just kind of touching all aspects of that and making sure that we have the resources we need. We have a good working relationship with all of our providers. It's a healthcare team, and it really is a team. And we come at it with a team approach, I think, whether it be an obstetrician or a certified nurse midwife, that's the care provider. I mean, we'll cross all boundaries together to get the job done.
And for the health of these babies that are starting their lives there. And some babies born to term and other babies that are born a little bit earlier. And I'm learning about perinatology and what the staff person that you have at OMC. So can you talk a little bit about that?
Yeah, we have a perinatologist, Dr. Wendy White, and she oversees anyone that's referred to her or meets criteria for certain diagnoses, which I'm sure Dr.
High
Richards
blood pressure, diabetes.
Talk about it.
It's really special. I think we've talked about this many times. People make the choice to go to Olmsted Medical Center, so we want to make sure that we can take care of them safely. So starting in the clinic setting, Dr. White, being a perinatologist, she's gone to medical school like me. She's done an OBGYN residency like me. And then she did an additional 3-year fellowship after being an OBGYN actually at Olmsted Medical Center at Mayo. And so she works primarily in the clinic, and we use her as such a great resource and gives excellent recommendations during pregnancy, but also when it comes to timing of delivery and what to expect. And then, I even look beyond within our department with our relationships with the surgery department. If a patient needs a cesarean section, working with the emergency medicine colleagues, even over with the hospitalist team, we're really have to be a team in order to do this.
Diabetic education, like it's very far reaching to all of the services that you would need for that moment in for your life and anything you could need for during that period, but and beyond too. Making wonderful connections with our pediatricians.
And so it really seems to me that teamwork approach starts in the clinic setting, seeing a variety of patients with a variety of different needs.
Many of our patients are what I would lovingly say pretty boring. Like, be boring.
Yes.
You'll hear me say that a lot.
Yeah.
Like, stay boring in this room.
Yeah.
And a lot of our patients fall into that category, but we do have a category of patients that aren't boring, whether they have high blood pressure issues, diabetes that develops during pregnancy or even before pregnancy. And we want to keep those patients where they want to seek their care. So we have Dr. Wendy White, who's our perinatologist. So a perinatologist has gone to medical school like me. They've done an OBGYN residency like me, and then 3 additional years of training and a fellowship in giving consults for these high-risk OB situations. So it's great how Dr. White, as our perinatologist, can help us out in clinic and then set us up for success in the birth center setting. The caveat, the big thing there is we need to be able to take care of those babies after they're born. I can deliver anywhere down to 23-week babies. However, after the baby's out, we need our awesome birth center staff to be able to take care of those patients. So I would just love Lisanne to like touch on how we're able to take care of these higher risk pregnancies when after the baby's born.
Yeah.
Well, we're really well educated in all aspects of pregnancy diagnoses, stages of gestational stages for babies and what their particular needs are at those different levels. And we know where our limitations are. So within those limitations, we are so skilled. We're able to still meet a lot of birth plans, I would say, given the safety and clinical appropriateness of that child. But we have also, for the higher level units, we have some isolate capabilities, some rooms that are dedicated to infants that need a little bit more help with some oxygen or long-term feeding plans or just whatever may be applicable to that baby. And we have dedicated nursing and training for that. We work well with our pediatricians in combination with lactation because a feeding plan is almost what it's all about too once you're in that stability phase.
Yes.
And you want to feel confident as a family and a new parent as to what is this feeding plan going to be when we do get to go home or transition out of that higher level of care. So I think we do a great job with care conferences, and we want to include family in some of those decision-making processes, and at least being aware of what services we offer for the specialty needs for maybe a baby born just a little bit early, and what that transition is like from the nursery to the back to the labor room, postpartum room, and then on your way home.
Can you talk a little bit about something that makes I think us a little special in our relationship with Mayo Clinic and our neonatal telemedicine program that we have?
Yes, we have an excellent consultation service with them where we have a remote device access where we can do consultations on demand with Mayo's NICU services. And so we can make determinations on that, on level of care if we have some additional questions. Oftentimes what that allows for is our families to stay together.
Yes. Yeah.
And that's one of the most important things is not being able to transfer a baby while the mother is still admitted with us. So we have ways to get around that too and make connections should that be the case. But this allows families to be together longer. We have a lot of really confident information. And when it is time to maybe use our service partners across town, we feel really good about that too.
What a great collaboration.
It's really neat.
What a great collaboration. And like, we want to keep a baby together with the parents and not move this baby. And what it just see like such a great thing overall to be able to have that great service.
And we all know that skin to skin and like feeding and cares, no matter what the stage are, is going to
getting
be
a rush of endorphins. Just
yes,
thinking
it's going to
that
be
first
imperative.
skin to skin time, right?
It's great for moms, especially great for babies when they're in transitional stage.
Absolutely.
Mhm.
One of the things I'm very proud about our telemedicine program is how that started out as a grant. It was a generous gift from the Matt and Lindsay Sloggy Foundation, and it lasted for a couple years to the grant. And then by being able to do a proof of concept, it is now fully funded through Olmsted Medical Center. And it's so neat to see what generosity will do and investing in our birth center team. It helps. It makes such a difference for our
direct
patients.
impact.
Absolutely.
Sure. Amazing. Wow. I'm getting chill bumps just thinking about this great just partnership and just how many wonderful things are happening in the birth center and between your teams and the collaboration and the care that the patients receive.
Yeah.
It's evident, right? That's how my relationship started with OMC, is just the ability that I had, or the opportunity that I had to share my incredible birth story with the team at OMC. So, Lisanne, I'm so happy that you were here with us today.
I appreciate the time.
And just the passion and knowledge that you bring to the role, and just how well cared for families are going to be when they start their new family. So anyways, thank you so much for joining us for Pelvis Party. If you'd like to watch more episodes, you can head to rochesterlocal.com/pelvisparty.